These operations are safe, they are effective, and they've also led to the types of clinical outcomes that are very similar to what we see in the adult world.
I think the biggest difference is that we truly need family buy-in. Because as an adult, they can do it even if their family doesn't want them to get surgery done. But as a child, they need to have familial buy-in. They're not the ones going and buying groceries. They're not the one choosing which restaurants that the family goes to eat. They're not the ones spending money on therapy or other medical issues if they have issues. So their parents have to be on board to help them. I even had one who had regained a lot of weight who told me that the weight loss during that period of time was instrumental in their development into a well-functioning adult. They felt that being thinner while they were in high school and college really helped them blend into society and feel a more normal adult and a more normal part of society that they would have never felt had they been as big as they were before I operated on them.
The pediatric population, by definition, is a vulnerable population. Everybody wants to see safe and effective and thoughtful care be administered to children, because at the end of the day, that's what we're talking about here.
I start my conversation with all the adolescents, directly talking to the adolescent, because they have to be able to explain themselves or any issues that they're having and be able to be mature enough to kind of follow the basic plans. And then I ask them, how's obesity affecting your life? And what do you want to get out of surgery? I can't play sports and I want to play sports and I want to be able to live a life where I can do the things my friends do. Then they're already starting to think about how obesity is affecting their life, and they can already understand what the benefits of getting rid of it would be.
These are patients that are seeing vast improvement and in many instances, complete resolution of type 2 diabetes, high blood pressure, chronic renal insufficiency. The list goes on and on. I think what's really notable about bariatric surgery in the pediatric population, when you compare it to the adult world, there's some evidence that there may actually be an advantage to operating on patients in this earlier age group. The comorbid conditions that go along with this tend to get worse with time. We should not be watchfully waiting because things will only get worse. And that's a really important take-home message here.